February is Heart Month, and Channel 7 is partnering with Baptist Health Heart Institute to have heart doctors answer your heart questions. Joining us this morning is Baptist Health cardiologist Dr. Anthony Fletcher. He's here to explain how exercise can get you heart healthy. You'll recognize Dr. Fletcher. He comes on Daybreak quite often. Today he's here live in studio on Good Morning Arkansas. I'm glad to have him.
From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Well, welcome back. February is Heart Month, and tonight Channel 7 is partnering with Baptist Health Heart Institute to have heart doctors in the studio answer your heart questions. And joining us this morning is one of those physicians, Baptist Health cardiologist Dr. Anthony Fletcher is here, and he's going to talk to us more about the phone bank as well as how exercise can get you heart healthy. Good morning.
Good morning. How are you?
I'm doing good. Of course,
fantastic.
January starts the year. Everyone wants to be healthy. How important is exercise? What is important about exercise and heart health?
Well, exercise is extremely important. This is an exciting month. It's Heart Month. It's Valentine's Day. It's the beginning of the year. People are starting to make commitments that they want to be healthier. They're joining health clubs. So exercise is extremely important. It's important because the heart is a muscle. Yeah. And the more you exercise that heart, the healthier it's going to be. And you put it in an environment where it's able to perform at a higher performance level. So we want to talk about exercise. It's never too late. And you can just start off simply by just saying, I'm going to do this. And you start off maybe with 10, 15 minutes a day. Yeah. With your goal being trying to get yourself up to about 30, 45 minutes.
So you don't have to go from 0 to 100.
Absolutely not.
You can start small.
Absolutely not. I think it's important that you kind of phase yourself in.
So how do people figure out what kind of exercise is right for them?
Well, I think, first of all, you look at your fitness level. I mean, obviously, if you're an athlete or former athlete, you know certain exercises and you know your body. So I think, you look at what you like to do also. So do you like to walk? Do you like to cycle? Do you like to swim? Some people do resistance exercises. You can mix that up. So you look at things that are user-friendly and things that are even available to you. And if you have no facilities, just walk. Use the environment around your house. And you can even do exercise in the house.
Yeah. So for a lot of people, it's hard to get into the habit. It's something they can do for the month of January.
Absolutely.
But continually over a year, it's hard for them to do. What are some things they can do that make it more of a habit for them?
Well, I think first of all, find something fun. And if you have something that's not a chore...
Yeah, like playing basketball for me is a lot of fun.
Absolutely. And so you surround yourself with people that you like to exercise with, for example. Or, if you like to listen to music while you're exercising, or your TV programs. You can be doing things at home while you're exercising. You can be watching the Super Bowl, for example, and exercise while you're watching the Super Bowl.
Yeah.
Absolutely, no question. So make it fun, make it user-friendly. Put yourself in an environment. If it's difficult for you to exercise after work, exercise at home before work or after work. Or if you have a lunch break, you take your break and do your exercises.
Absolutely. So how much exercise is a good amount?
Well,
Does it vary per person?
It varies per person in terms of how you begin, but the ultimate goal is to get you to about 150 minutes of exercise per week, aerobic type exercising. And again, you may not be able to do that initially, kind of break it up, 3 to 5 days a week, 20, 30 minutes at a time, and then as you become more fit, you can progress that time so that you're able to get that 150 minutes per week.
Yeah, absolutely. How do you keep from getting bored with your exercise? Just
again, variation.
Make it fun?
Make it fun.
Yeah.
Do things you like. And again, if you have friends that you like to hang out with while you're exercising, you can talk and share war stories while you're exercising. Again, listening to music, putting yourself in a good environment. Don't make it a chore. I mean, make it fun.
For some people are hesitant to get involved in exercise because it's painful, it hurts, it is not a fun experience. So what kind of precautions should people take when they begin exercise?
First of all, know your health. I mean, if you have underlying health issues, make sure that they're controlled. For instance, if you're hypertensive, if you have a history of previous heart attacks, or if you have angina, if you have bad emphysema or COPD, there's certain underlying conditions that we call cardiomyopathies, where your heart's kind of weakened or enlarged or thickened. So know those conditions. Visit with your healthcare provider and make sure that you get a good examination prior to beginning that exercise.
So it's really just knowing your body.
Knowing your body. And they may even want to think about a stress test if you haven't exercised for a long time and you're an older individual.
Speaking of knowing your body, are you ever too old to exercise?
Absolutely not. Exercise is probably the fountain of youth. And my patients in the office hear this all the time. So the younger we get, I don't like that other word, older, the younger that you get, the more you need to exercise. It helps you keep your flexibility. As we get younger, again, older, you start to lose muscle mass, you lose lung function, and exercising helps slow that process. And again, by exercising, you can help prevent the development of diabetes and hypertension and other chronic illnesses.
You can kind of prevent some of those health risks that develop as you get younger.
Correct. And again, exercise, again, allows you to live a better quality life.
Yeah.
It may even enhance how long you live. So exercise is key. And I think Fountain of Youth is the way I kind of bracket exercise.
Yeah, I think my grandparents definitely benefit from that as well.
Fantastic.
They've worked out for a long time. All right, well, tonight's the phone bank here at Channel 7. Are you going to be a part of that?
I'm going to be a part of that. We've been apart for years, and it's an exciting time. It's the patient's opportunity to call and ask questions.
Yeah.
And many times, you know, you're given a second opinion. They have cardiologists, but they'll call and say, so-and-so put me on this medicine. What do you think? So it's a fun time. The doctors enjoy it, and we look forward to having people call in. So please take advantage of that and call us tonight.
Yeah, and you can never have too much information when it comes to heart health.
Absolutely not, for sure.
Well, all right, Doctor, thank you for joining us this morning.